Good afternoon, everyone. I'm Sayukta from All About Skin Allergy team. And I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals present in certain food items, allergy to certain medications, insect stains, sunlight, and sometimes the causes unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of tests required for diagnosis, and the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Amee Daxini, live from Think Skin Clinic, Bangalore. She'll talk about urticaria and its management. Dr. Amee started and completed her MD in dermatology and before that MBBS, and she practices as a senior consultant at Think Skin Clinic, Bangalore. She has been a successful dermatologist for more than 18 years now. And Dr. Amee conducts regular training for dermatologists in advanced procedures. The advanced trainings that she has taken is mesotherapy from Aesthetica, Spain, advanced facial sculpting from Allergy, Dr. Arthur Swift. A very warm welcome to you, Dr. Amee. It's a pleasure to have you with us.
Thank you so much. Thank you. And it's a pleasure for me, to come on such forums because sometimes, we know so much, but we're constrained with our location and where we are placed and we can't spread it to everyone. So thank you so much for getting us live on Facebook so that our experience we can share with so many more people. So thank you.
That's so kind of you because actually, as I just mentioned in the beginning, that it is very common, to have urticaria. But the thing is that the people are not aware of it that much. And again, because they are not that much aware, they feel it's some kind of stigma, it's some kind of taboo still to talk about skin allergies. And then they keep on suffering in silence. So I'm really glad that you are here to discuss this. And surely from this platform, through this session, we'll try to create some kind of awareness over urticaria and its management. So, doctor, to start with, first of all, what is urticaria?
So see, suppose when we eat something like, commonly say Karela, okay, and immediately, we cringe because it's so bitter, because we don't like it. Our taste, buds tell us it's not good. Right. Similarly, when our body is exposed to certain things which they don't like or they don't consider it as good, they throw a reaction. So our emotion is, cringing, and the body's emotion is to throw a reaction in the form of redness, in the form of raised skin, which then subsequently becomes very itchy. Because when a blood supply to an area increases, it gets with it all the other active ingredients, and one of them is histamine. Histamine is very itchy. So then the skin becomes very itchy and there is a lot of discomfort. Now, as you very rightly said, people don't take this seriously. They think, acha, ek allergy ho gaya, bed bug hoga, bite hoga, and they just leave it unless it becomes so frequent that they cannot, then stop itching, and their entire mind and focus goes to that is when they come to a dermatologist. So creating awareness right from the beginning really helps us doctors to find the cause and give faster treatment.
Exactly. I completely understand your point and agree with you because, many times what happens, as you said, it's body's reaction towards something. Now, what happens, people are so aware about, allergy and anti-allergens, then they'll go and start doing self-medication, or they'll do what their friends have done when they, encounter such things.
Yes.
Or and actually they keep on wasting time, and by the time they go and land up in front of a skin specialist, it's too late in the sense that they have actually suffered a lot already. So yeah, definitely
Absolutely.
the motto is to create awareness over it. So now, as we know, what is urticaria, we would also like to understand, doctor, what causes urticaria? What are the main causes of it? Are you there with
Acute
us, doctor? Yes, yes.
Is when you get, okay, so acute is when you 1.5 months, that is about 6 weeks, and you don't see it again. Chronic urticaria is when it lasts beyond 6 weeks. So it's so frequent and it keeps coming every 24 hours, sometimes even less than 24 hours, and it keeps occurring over months. Now, the causes also sometimes are different. Like acute urticaria can be sudden allergy. Suppose you are allergic, say, to peanuts, or you're allergic to milk, you're allergic to pollen grains outside, and you're suddenly exposed to that, the entire body throws a reaction. Like you can even have swelling of the lips. There would be difficulty in swallowing because inside also the tongue swells up. All these are sudden acute urticaria because of an allergen that either you've consumed or you've got exposed to. Right. And that needs immediate treatment, immediately going to a doctor where we inject at that time, especially if the lips are swollen and the tongue is swollen, we give injections of anti-allergens. This time, if you just go out and, go to a chemist and take just, simply people just take cetrizine or they take Allegra, just because the chemist has given them, as you rightly said, their friends and family have told them, we can actually, get into a shock phase. So from acute urticaria, you can lead to shock. It's called the anaphylactic shock. And at that time, you can even lose your life. Yeah, these are all really serious cases. So it's very important to understand that if you notice these symptoms, you immediately need to go to a nearby dermatologist or a hospital so that you get your first aid quickly. So this is your acute urticaria. And then comes your chronic. At least about 20 to 25% of urticaria, sometimes acute urticaria, goes towards the chronic phase. That is, it goes beyond 6 weeks. Now, these chronic urticarias are because of chronic exposure. Like suppose you're working in an environment where there are certain chemicals, like you're in a lab, or you're in the construction industry where there is a lot of cement and other things. Constantly you're exposed to the allergen, and that's why you keep getting this, rash all over the body beyond 6 weeks. That's the time it becomes chronic, and you need to again go to your doctor to decipher what is the cause. So we as dermatologists sit back and we actually start talking about what you're eating, where you live, where you work, in your lifestyle, what is causing the urticaria. And then we stop that. That's the first thing. The second level, what we do is then we do blood investigations. So we try and find out what could be the problem. So when we do blood tests, the first thing that we try and find out is something called eosinophilia. This is a blood cell which suddenly grows in when there is allergy in the body. So the minute we see that has increased, we know that we're dealing with urticaria or allergies, and we give anti-allergens accordingly. So, that's the second phase. And the third, of course, is the treatment. We plan the treatment basis the cause of urticaria.
Right. In the beginning, I was just assuming it to be rashes or elevated skin, as you were, telling about the things, and it will itch a lot. So I thought maybe itching is the worst thing. But then, as you, elaborated how bad it can be, I would like to ask you, doctor, you also said it can actually, it can be life-threatening. Now, my question is, how common is it? I mean, is that just the rash or the itching part which is more common, and it becomes life-threatening? The chances are really rare, but still we need to be careful about it. That's the whole purpose of this session. So please explain to us, is it life-threatening?
Yeah, so acute urticaria, as I was telling you, if it is suddenly due to a huge amount of allergen, like suppose you're allergic to eggs, right? And and you avoid eggs most of the time, but by chance, you go out with your friends and you just have a piece of cake without thinking that that has egg in it, and you've consumed that egg. That's the time your body will suddenly throw a reaction. And as I said, you will have swelling of the lips, the tongue, there'll be difficulty in swallowing. These are the sudden cases, but again, very rare, which can lead to a life-threatening situation if you don't go to the doctor quickly. But generally, urticaria, like about 85% of urticaria is chronic. Now, when I mean chronic, it's long standing, it's beyond 6 weeks. So the biggest issue then, as you rightly said, is the itching and the red rash, because it looks very uncomfortable. If you see even us, like you're wearing a good dress, and if you see urticarial rash or red rash on your body, people will keep asking you, oh, what happened to you? So it affects your self-esteem, your confidence, plus the itching makes you a bit uncomfortable because you can't focus on anything. You're constantly wanting to itch. So these two are the commonest. About 85% of them just complain of that.
Okay, and with that also, I can understand the discomfort and frustration and irritation a patient, goes through because he's continuously itching. I'm sure people must be, in a state of mind where they avoid going into public or going to social functions or family functions, etc., because they want to avoid that embarrassing situation. Now, again, because it's so uncomfortable, even the itching part is so bad that you need to go and consult a doctor as soon as you discover that something is wrong with your body or your skin. Now, my question again is that because we are talking here about a skin condition, and skin rashes or other allergies are also very common. Now, how to differentiate whether what we are having now is, anything closer to urticaria, or we need to be serious about it, or we need to consult a doctor. So again, how does it look like? You have already told us, but still, how to differentiate it?
I will tell you.
From other rashes.
So how to differentiate urticaria is very simple. As some of my patients come and tell me, I feel it's like small pillows or gadda. They say that they're flat, they're raised, and they're soft. So that's a typical allergy. If you get allergies to something else, like suppose, you've gone and done a facial and that facial didn't suit you, then you get allergies. They come in the form of tiny pimples or bumps,
Right.
They will never be flat. These are flat, they are raised, and they are soft. They're red in color. Sometimes they also feel warm. When you touch, they are warmer than the rest of the skin. And of course, they are very itchy. The thing about urticaria is also that it keeps disappearing. So, it'll come by the time you go complain to somebody, in half an hour, it'll just disappear. It'll just vanish and then come back again. So that's also another symptom that we need to see when we're looking at urticaria, because they generally go away within 30 to 40 minutes. And then they recur or reappear after a couple of hours, sometimes even after a couple of days. So that's one thing about urticaria, which is very typical, which you don't see in other allergies. Like suppose you're wearing a leather strap watch, right? And the leather doesn't suit you. You'll have allergy only over there, and until you don't treat it, it'll be there. Whereas urticaria just vanishes and then again comes back. So that's a very common symptom, which, if you really want to know whether it's an allergy or urticaria, you can figure this out.
Right. Now, doctor, with allergies, there's one condition where, people are aware that what they are allergic to. Like you said, many people are allergic to eggs or seafood, or seafoods or peanuts, etc. They may be also allergic to pollens or dust or extreme heat or, a change of weather, etc. But then there are also people who are not aware, or maybe they didn't have any allergy till date, but suddenly, they experience that something is wrong. Now, how for the, first timers, how to keep a track on it? I mean, can we maintain a diary or something where we can, jot down that last time I had egg, I had this problem. Now, when I'm having egg, I'm having this problem. So, is there a way to sort it out?
Absolutely. So urticaria, like especially chronic urticaria, is again multifactorial. Like I'll give you an example. Every time you come out from the gym and you're sweating, you get a rash. right? Or every time you have a nice hot water bath, you get a rash, which is extremely itchy and red. So that means you have urticaria to heat. It's basically when the body's temperature increases, you're getting urticaria, right? Sometimes when you sweat, as I said, post the gym, you have cholinergic urticaria. Some people, if you carry a heavy bag, say on your arm like this, you will get urticaria here. Or if you just scratch, you will get a red line like this over here. So these are all signs of induced urticaria. When you're doing something, you're getting the rash, right? So that is induced urticaria. And some urticaria are where you can't find out. I mean, during the day, it just happens. Sometimes you don't know when. So what we as doctors say is, you write down what you've eaten and done the entire day. Now, I'm from Bangalore, and Bangalore is very high in pollens. So, we have certain patients who go for an evening walk, and when they come back is when they see the rash. So when you write down all these things, you notice that every time you go for a walk, you come back with a rash. So that means you know that there's something in the environment that where you are, you're getting the allergy. There are some people who get it due to food. So, when you write it down, when you have the second and third episode, there's something that is common. Like, I'll give you an example. There was one girl who would only eat, whenever she ate a walnut brownie is when she got the rash. So when she started maintaining that, she realized that the walnut brownie caused the rash, and then we could figure out it's walnuts. So maintaining this, a diary of not just what you've eaten, but also your lifestyle, like whether you've gone for a walk, is it after a gym, is it when you feel very cold, is it when you eat ice cream? That gives us an idea what is the causative factor.
And as we are going into deeper and trying to figure out what can cause urticaria. I'm in an impression now that anything and everything can cause urticaria. You can be allergic to
Absolutely.
anything. Now, my question is, many people, because as we were discussing earlier, that despite going to the doctor, they'll try to find out what they can do by themselves. I mean, even before going to a chemist, they'll try to do something on their own, which we call home remedies. They'll try to, check out something or try something. Now, because again, anything or everything can, trigger urticaria. Now, my question is, how safe or how bad or good practicing home remedies can be for urticaria?
See, dear, the biggest problem as a doctor and dermatologist, I'm against home remedies is because, one, we don't know the cause, right? So, what do you do? What do you apply? Our elders tell us, okay, because there is hot, you apply ice, you apply aloe vera gel and everything will settle, and they put powder, because a body rash, sometimes they just put a powder to reduce the rash. Now, all these things, right? One, they're not going to change the way the urticaria presents. So it's not going to reduce your itching. It might just give you a little temporary benefit, but you're losing time, right? And that time is very critical for the dermatologist to figure out what you had done at that time that caused the urticaria. So that loss of time makes the diagnosis and the cause very confusing. You spend 2 or 3 days just applying aloe vera gel at home, and after 3 days, you don't even remember what you did, which caused the rash. So we're losing time in diagnosis. So that's why I really want everybody that the minute you notice something, if it's very small, it's very important to go at that time to the doctor. Higher chances of knowing what is the cause of the urticaria. So that's one thing. The second is also, consuming Ayurvedic or sometimes home things, at home, we don't know what is going to react and how. We might just again aggravate the situation rather than actually control it. So it's always better not to even take things orally before you meet your doctor.
So the bottom line is that you need to go and consult a qualified dermatologist as soon as possible, as soon as you start, realizing that something is triggering these urticarial reactions on your body. Please go and consult your doctor before it becomes a very serious issue. Anyways, it's a serious issue, and the good part is that treatment is there. So there's no point in suffering in silence. There's no point in avoiding socializing, etc. You can behave as a normal human being. So please go and consult your doctor. Don't waste your time on home remedies or self-medication or over-the-counter medication.
Absolutely. And at this point, I also want to insist on the fact that, sometimes people think that this is how my skin is and kind of accept it, because they think there's nothing I can do about it. Because
Right.
chronic urticaria is very long standing. So after a while, they get fed up and they lose hope. That's one thing we should avoid. The second thing is this fear in an Indian mind that I don't want to take allopathy medicines because they are chemicals. So these are the two things I really want people to understand, that even water is a chemical.
Exactly.
Even the food that you eat is a chemical. So what is so scary about a chemical? It's so important to go take the right medications, and these medications are all clinically tested and tried over years. So there is no chance that it's going to cause any other, problem or hassle to your body. So
Right.
don't fear chemicals, That's one thing I just want to say.
That's very important. Actually, the fact is that if I, use this platform to tell the viewers that please go and have H2O, they'll start Googling
Yeah,
what's H2O, they'll put 1,000 questions. But if I just say, please have water, they'll go immediately have water, no questions asked. Now, the thing
absolutely.
is that with the chemical part, we are so scared of it. The fact remains that a doctor actually knows what chemical they are, prescribing and how much
Exactly.
dosage, etc. When we are using anything on our skin, even if it's a home remedy, we are actually applying chemicals without knowing what
Absolutely.
chemical we are applying, without knowing what dosage, etc. When we are using over-the-counter medication or anything else, again, we are actually consuming or applying chemicals without knowing anything about it. So it's best to go and consult a doctor, because even if they are going to, prescribe you chemicals, they know about it. They know about you, your condition. So please go and consult a dermatologist. Please don't waste your time in doing anything else, and trust your doctor. That's really important. Now,
You,
again, doctor,
you
as you just
nailed it.
because yeah, trusting your doctor is really important. As you just mentioned that especially in the case of chronic urticaria, because the treatment can actually go on and on and on for months, etc. Now, my question is, how will they go away, and do they actually go away forever? Chronic urticaria.
So that's the hope, dear, that it should go forever. The other thing, what I've noticed in my patients with urticaria, and there are quite a few clinical studies saying that urticaria is also related to our mind. Now, just to step back a little, the skin, the brain, and our gut or our intestine, these three organs are very, very closely related. Anything that doesn't work well in one of these affects the other two. So if you are tense, like say before an exam, then you will get cramps in your abdomen, you'll want to go to the washroom, you will start getting pimples on your face, because you're so tensed, your brain is overworked, the other two organs will get affected. Similarly, in urticaria, we are seeing that the other two, that is the brain and the gut, malfunction many a times, and that comes out in the form of urticaria. So people who've undergone a lot of stress, or loss, grief, like, death of a loved one or movement or change in place, this kind of grief also can trigger a reaction which can manifest itself like urticaria. So I want to tell people that, many a times we don't find the cause. As doctors, we can't find the cause why urticaria has happened. And we need to step back and think, is it because I'm stressed? Is it because there's something not happening right in my life, which I need to actually get it right? So that is one. The second, urticaria will also notice when the gut is malfunction, like you have too much of acidity, or you are noticing constipation for a very long time, then the gut bacteria change. We call it the microbiome. And this microbiome, or the good bacteria of the gut, when they start coming down, they release certain inflammatory agents which cause urticaria in the skin. So when we eat things like curd, buttermilk, all these probiotics which maintain the bacteria of the gut, we see urticaria coming down. So not just medications, but we also need to check our lifestyle, our stress factors, how we eat, how we sleep, all that affects your urticaria.
Mhm. Right.
So yes, there is, most people get cured, but there are a very handful that live with it lifelong.
Right. And but what you just explained, we are now also yeah, one again take away is that urticaria can be caused by stress as well. Stress can actually cause urticaria. So we need to have a stress-free life, which is not that easy, but yeah, we
Yeah.
can do something to attain
Yeah,
that.
and as a dermatologist, it's so important. I always tell my patients is that it's not that there is no stress in anyone's life. All of us live in stress,
Right.
be it a small child or be it, an adult.
Mhm.
But how we deal with that is very important. So that dealing with it is extremely critical. And every day you need to find some time for yourself. Like a mother, I understand running behind children, doing your work, housework, maintaining social life, everything is there, and we forget that we need time for ourselves. And such people, we notice, present with symptoms more, and those symptoms last longer. But the minute they start looking after themselves, giving themselves some importance, that's the time we notice that their urticaria starts reducing.
Right. And one more thing, doctor, that I would like to ask, because many patients complain that their hives or urticaria get worse during night. What's the correlation?
See, one of the reasons is temperature. Because many urticarias are temperature mediated. So when the temperature comes down, the urticaria increases. The second is also because of the environment. At night, there are certain pollens that are released. Those pollens can cause allergy to you. So that can increase or aggravate urticaria. Some people have a habit of taking a hot water shower at night, then it can cause urticaria. So it's very important from person to person and case to case, we find what's the cause, but mostly it's temperature.
Okay. And many times people also complain that they are, feeling very tired or fatigued because of urticaria. So why is that?
Yes.
So,
See, because our body is under stress, any
hmm,
reaction or anything, it may not be a disease, but this is a kind of malfunctioning that can take away all the nutrients in the blood to that organ, because that organ is diseased. Our entire focus of our body is over there. So rest of the body does not get that much attention. That's when we start feeling stressed, fatigued, and also the fact that constantly you're itching and constantly you're doing something, that also causes mental fatigue. So it's both ways, it's physiological as well as mental.
it looks like a vicious cycle, a lot of stress, which can lead to urticaria. Urticaria can lead to a lot of stress and tiredness
Yeah,
and fatigue, etc. So the only way to get out of it is to go and consult a dermatologist as soon as possible.
absolutely.
We'll also keep on taking some of our viewers' questions because a lot of questions
Sure.
are coming. So I'll
Sure.
take Suman Yadav's question first. Ma'am, how to obtain relief from chronic hives that are autoimmune other than antihistamines?
Yes. So see, autoimmunity is a completely different cause, which I didn't cover in this section, because autoimmune urticarias are because our own body is fighting against our own cells. It's like, a civil war. It's
Mhm.
not an invasion from outside, but it's from within. And in these cases, we really need to reduce the immunity of the patient. Now, here there is a catch. If you reduce the immunity, although the urticaria comes down, the patient is more exposed to infections because the immunity has come down. So the barrier function has gone down. So here, Suman, it's a very catch-22 situation. And with your doctor, with your dermatologist, we make a plan that we give you autoimmune immunity reducer, some agents for a short period of time, control the autoimmunity, keep you on antihistamines, and then, see how you're doing. So we give steroids, we give non-steroidal, anti-inflammatory agents also. We give non-steroidal immune-reducing agents. We can take azathioprine, colchicine, methotrexate sometimes. All these are medications which reduce the immunity and help an urticaria patient. But as I said, it's a long time discussion, and you need to talk to your dermatologist and see what works best for you.
Exactly. Now, Sameer Singh is here asking, should I completely stop eating cooked food to cure chronic urticaria? Cooked, I think he meant uncooked because
Oh,
I don't
yeah.
know.
So see, Samir, right? His name is.
Yes.
Yeah, so Samir, the thing is, one just doesn't know what causes the urticaria unless, of course, you figure it out. There are certain food allergy tests that we recommend. Sometimes, we're not allergic to one thing, we're allergic to group of things, like say pulses, or say seafood. So for that, we have certain blood allergy tests where we test more than 150 ingredients to see what is causing the problem. So in these tests, we figure out what are the ingredients that you shouldn't eat. But you can't stop either cooked or uncooked food unless proved otherwise.
Right.
So you and figure out what doesn't work for you.
Right. Now, Shiva Shankar is here asking, how do I get rid of acute urticaria?
So Shiv, for acute urticaria, you really need to acutely and quickly go to your dermatologist because that's when we need to find the cause. Acute urticarias sometimes can be life-threatening. So it's very important to know what is causing that problem. That is why you need to go to your doctor. I'll tell you one very, very funny tale. So there was a South Indian that went to Mumbai, and the travel time was so long that every time he would switch platforms, go from central to western, he would pick up a vada pav and eat. And every day when he would do that and reach home, he would get severe urticaria to that extent that his lips also would swell. And it kept happening every time that he traveled. And weekends when he's home, he wouldn't see it. And when he went to a dermatologist, sitting and analyzing why, they realized it's the besan, the vada pav, the besan that they make in, he was allergic to that. And then after stopping that, his urticaria just vanished. So it's
Right.
very important to go and discuss this with your doctor.
Exactly. So please don't suffer in silence again and again. We are trying to tell you that because, maybe the cause is so easy to find out and so easy to omit from your life that you can have a very normal life. So please don't waste your time and go and consult your doctor. Sadhna Mishra is here asking, ma'am, मुझे last 7 साल से पैर की लास्ट फिंगर में इन्फेक्शन बताया डॉक्टर ने, बट ये परमानेंट है, हर मौसम में पेन रहता है, तो क्या ये कभी नहीं जाएगा? He's not talking about urticaria. I think he's talking about something else.
Yeah, she's not talking about urticaria. It could be because it's the last toe, right? It could be because of pressure. Many a times when we wear closed shoes, right? This finger or this toe gets a lot of pressure. So it could be just because of that pressure. Don't worry, wear loose shoes. That should help you. Plus, if your nail is growing inwards, you might get that, redness and swelling. So just check the toenail, but it should get cured. It'll never remain lifelong.
Okay. Praful Dubey is asking, I have been suffering from chronic urticaria for almost 1 year. Do you have any cure on this? I feel like I'm not in a healthy mood and my sweat gland does not work properly as well.
That's right. This urticaria is more of a psychological problem, not just a physical problem, And I really want you to go meet a doctor if you've not already done. The other thing is in chronic urticaria, if nothing is working, it's good to do the food intolerance test. Because there are times when we notice very simple things like potatoes, people can get allergic to. And believe me, there is one very big misconception that we have that urticaria or allergy can happen only from birth. People say, oh, but I've been eating potatoes all my life. Suddenly, why should I get allergy to potatoes? But as we grow, we change, our cells change, our environment changes, our emotions and response changes. So we can get allergic to anything at any given time. So this case, right, if it's since a year, I really advise you that you get your food intolerance test done, check what things don't work for you, omit them in your diet, and hopefully you'll get rid of it.
Okay. Now, as we are talking about, diet right now, I would like to ask you, doctor, is there any dietary precautions or do's and don'ts for the patients of urticaria?
So ideally, we don't say that you shouldn't take anything. Of course, if you figure out what is causing it, it's good to stop that. But baseline, we know there are certain foods which are irritants, like say peanuts, walnuts, egg, seafood, especially prawns, mushrooms, and all underground vegetables like yam, elephants, yam, all those things are more allergenic, brinjals. So when you are still not sure what is the cause, try and avoid this list at least, so that these are the common allergens. But ideally you just need to find out what is the cause.
Okay, we have Sameer Singh Kushwaha with us, who's asking, is urticaria a blood disease?
So Sameer, you can call it blood related, but urticaria is not a disease, it's a disorder. It's something where something is not working orderly. If we fix the order, it'll get treated. So it's a disorder. Yes, it's transmitted through the blood because the allergens are picked up in the blood and antibodies are produced. So it is in the blood system. You're right.
Okay, and doctor, many times with the skin allergies or skin rashes, we have this notion in our mind that we may get it from somebody else. So in the case of urticaria, is urticaria contagious?
So urticaria is not contagious, dear, but we can genetically be predisposed. So if our parents are allergic to something, there are chances that we can get those genes.
Mm-hmm. Okay, and though you have already talked about the treatment options that we have for treating or managing urticaria, again, as we are now processing towards the conclusion part of this session, I would like you to throw more light or on this treatment option that's available for treating urticaria.
Yeah, good you covered this question because it's very important for everyone to know. The first commonest thing that we doctors give is antihistamines, because histamine is what causes the rash, the wheal, the itching, everything, right? So that is the gold standard. But along with that, we give certain, like in autoimmune cases. In autoimmune cases, we add steroids, we add immunosuppressants. And now when urticaria lasts for too long, or it is due to a specific pollen that we know, we have certain things called biologics. These are medications which are derived from our system, from our blood. They are called biologics, and we inject them. So you can consider it as an allergy vaccine. Like vaccines are produced for viruses, this is an allergy vaccine, which we inject if we know the specific cause. So that also can reduce your urticaria. But as I said, mainstay is to find the cause and give antihistamines.
Okay. And before we wind up, any take home advice message for our viewers, doctor?
Yes, the first thing, if you are seeing urticaria, be it chronic or acute, try and figure out the cause with an expert. Don't try and do it at home. Go to your dermatologist and discuss it. That's the first thing. Don't waste time. The second thing is when it's proven that it's chronic urticaria and very difficult to find the cause, we call it idiopathic urticaria, where we can't find the cause. About 80% suffer from that. Now, these cases, remember, we just live one life that we know of. So do not get socially so distant. Accept it and live your life the way you want to, because this is something which is not transmissible. This is not a taboo. It's just a little disorder of your skin, which is absolutely fine. So embrace it, live with it, and enjoy. Don't give up your life just because of urticaria.
That was a very positive way of concluding this session. Thank you so very much, Dr. Amee Daxini, for your valuable time. It was a very informative session, and I'm sure our viewers are going to, benefit a lot from what you just told them about urticaria and how to manage it. Thank you so very much once again.
You're welcome. Take care.
Thank you. And viewers, thank you for your active participation. In case you want to consult Dr. Amee Daxini, you can visit Think Skin Clinic. It's in Bangalore. The address is number 51, first floor, Amrita College Road. Landmark is BRS School. So if you are in Bangalore or you are traveling to Bangalore or you need to consult her, please go and consult her.
Yes, and you can also follow me on Facebook on Think Skin Clinic and on Instagram, Think Skin Clinic. That'll be faster.
Yeah, definitely. Thank you so very much, Doctor, once again. Really looking forward for many more such sessions with you on various topics.
Absolutely. My pleasure.
And viewers, again, thank you very much. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.